So Bernardino Ramazzini is the next biography which we are considering. Okay. Bernardino. Okay, sorry. Bernardino Ramazzini. So let's talk about the biography of this great scientist and basically looking at what the contributions he has made, to science. So this man, we said that his early life, he was born on October 4th, 1633. He was born in Carpi, Duchy of Modena, and that's in Italy. So he studied medicine at the University of Parma and he graduated in 1659. Okay. So early in his career, he practiced medicine in various Italian cities, developing a key interest in the relationship between work and health. Okay. So his key interest was basically how work is able to affect the health of a worker. So how did his career go? He was a physician in Modena and later became professor at the medicine of medicine, right, at the University of Modena. So that was even where he was born. So he achieved the dreams that all of us usually want to achieve, giving back to the community. So in 1700, he published the most famous work, which is known as the De Morbis Artificum Diatribum. That's diatriba rather. That simply means disease of workers. So that was the first comprehensive study of occupational disease, trying to say this person works in this particular place, that's why he has this disease. This person works in this particular place, this is why he has this disease. So he was later appointed a professor of medicine at the University of Padua, which is actually one of Europe's leading center of learning. So his contribution to occupational health is he's known as the father of occupational medicine. Right, that's like a nickname. He looked systematically, okay, that's basically involved in his book. He described all the diseases and health problems that usually affect workers, and he touched about 50 occupations. So this man did a lot of research, right? So this include miners, include painters, include midwives, include soldiers, So introduce the practice of asking patients, what is your occupation? So if you are clerking a patient in a hospital today and you ask the patient, what is your occupation? For every time you ask that question, you say thanks to Ramazzini. Okay. So he identified hazard like how dust is able to cause disease, how chemicals are able to cause disease, how repetitive motion is able to cause disease, how poor posture is able to cause disease. Then he also advocated for all those preventive measures, improved working conditions, and recognition of occupational health as a medical discipline. Okay, so some people could even for somebody to be able to work under a factory as a medical provider, like we're attending to the workers of such a factory, you must have a very nice knowledge of occupational health. Do you understand? So it's a discipline in medicine under community health, or you could say public health. So his personality and influences, he actually combines scientific observation with compassion, emphasizing how workers are important to our community and how workers need to be taken care of. His work influenced later physicians and reformers like the Percival Pott and the Charles Turner Thakral, and all of them. Don't worry, we'll get to talk about their We get to talk about their biography. He also helped to shift medicine towards a broader understanding of environment and how that's your work, is able to cause disease. He died November 5th in 1714 in Padua, Italy. He's remembered as a visionary who led the foundation to modern occupational health studies. His insistence on linking work conditions to health outcomes remains a cornerstone of public health and also preventive medicine. So that's it for Ramazzini.